I met Dr. Leland about 10 years ago. We were both lobbying for the benefits of Medicare beneficiaries.
I had worked for many years with older adults in nursing homes, and I was frustrated by changes in policy and how national policy changes were impacting what I could do with my clients.
One of the projects that she's working on now actually is a really a national scale trial where she's looking at different ways to provide care for older adults who have dementia and are residing in nursing homes. And that's a really pivotal study.
We are one of the first PCORI studies that's been funded in nursing homes.
It takes the perspective of the family, the patient, and also the clinician delivering the care. The elderly population with cognitive impairment. The services we have for them are currently inadequate.
I spend a lot of time with my grandmother and my 2 great aunts, and when I have those challenging days, I think back to what would I want the therapist to do who is working with my loved ones.
She is looking at policy, she's looking at the healthcare industry as a whole, and really trying to figure out how do we move forward so that rehabilitation can have the best outcome for our patients, and at the same time also make sure that we're being innovative and really anticipating what the next change in the industry is.
The broader healthcare environment, it's changing so fast. It's being able to prepare students for a health system that we don't even know what will look like in 5 years.
PITT benefits by having Natalie here practically in the fact that she draws more attention to our health services research in rehabilitation. Again, health services research is not new, but it's new to rehabilitation, and there are really only a handful of scientists nationwide in any discipline of rehabilitation that have the skill set that she has. But she also is highly collaborative, so Natalie has been heavily engaged with our health services researchers in physical therapy, in audiology, in speech-language pathology, in collaborating and mentoring even senior investigators in these new methods.
At the core, I hope that what we're doing is to impact nationally that quality of care. I look at my research as building on the interventionists, the clinical trialists who have said these interventions are important. And then my job is to say, how do we get those into the health system to make sure everybody can access those services?